right now on Chronicle in High Definition.
He acts like a typical 10-year-old, playing games, teasing his twin sister, messing with his big brother.
Sometimes he can be a real pain in the butt.
But Liam Gannon isn't typical. Life's dealt him a tough hand.
He wants so badly to be like everybody else.
So he's come to Mass Eye and Ear Infirmary to get a brand new start.
That looks cool, Liam. Yeah?
In a place that's all about big goals.
Cure deafness, cure hearing loss.
A truly inspiring tale. Liam's story. Next on Chronicle. Good evening. Tonight we bring you the story of a young boy who's already faced many challenges in his life. Liam Gannon was born with a rare genetic disorder that makes him look different from his peers. But luckily, he's come to a place where life-changing procedures are part of the mission statement. Mass Eye and Ear Infirmary. In many ways, Liam Gannon is like every other 10-year-old. He loves to play on his Wii, watch videos on his iPad, and annoy his older brother.
Liam is an individual. Sometimes he can be a real pain in the butt, but he's still that person who you kind of have to deal with, and you kind of have to learn to appreciate the way he is and how he acts.
He's just unique.
Liam doesn't look like other kids. He was born with Treacher syndrome, a rare genetic disorder that results in a broad range of physical abnormalities. His physician, Dr. Michael Cohen of Massachusetts Eye and Ear Infirmary.
In Liam's case, this resulted in a very short jaw, which caused him breathing difficulties, resulting in the need for a tracheostomy tube so he could breathe. Also, his ears did not form properly, so rather than having normal appearing ears, he just had two small lumps of tissue where the ear should be. It resulted in some other facial abnormalities and some visual difficulties for him as well.
At the age of 4, Liam and his twin sister Tegan came to live with their grandparents, Debbie and Gary Gannon, in Irving, Massachusetts.
Communicating was very difficult for him. My friend was over here with him one day, and he was asking her for something. And she said, honey, I'm sorry, I don't know what you want. But he couldn't hear her, so she was, just, I don't know. And about 10 or 15 minutes later, he came back to her and pulled on her sweater, and she looked down, and he handed her a sippy cup. Asked for a drink that whole time.
Liam is a student at the Austin School for the Deaf in Brattleboro, Vermont. He's been there since he was 4.
When he went there, he had no words. And somebody followed him around, and everything he touched, they would give him the sign for it. And he slowly started learning what the signs were.
Despite his struggles, Liam's always had a sense of humor, says his grandmother.
He was fresh once. He was making a sign, and I kept saying, what does that mean? What does that mean? My deaf mentor came over to teach me, and I said to her, what's this? And she said, issues. And I said, so Liam's been telling me I have issues lately?
Okay, Liam, we're going to take the...
Liam's physical issues have no impact on his intellectual ability, says Dr. Cohen.
And that's one of the most challenging things about this condition. Liam is an intelligent, bright boy. However, at first glance, you wouldn't necessarily believe that because of the way that he looks.
He wants so badly to be like everybody else. He doesn't even know how unique he is on his own, but he just wants to look the same. Some kids are mean to other children when they look different.
Since birth, Liam has been treated at Massachusetts Eye and Ear Infirmary. A year and a half ago, he came under the care of Dr. Cohen, who started Liam on a path that would change his life.
When I first met Liam, he was wearing a bone conduction hearing aid, which is basically a spring-loaded device you wear on a headband, and it squeezes against the skull, and it sends sound vibrations into the inner ear, because even though his external ears did not form normally, he has a normal inner ear mechanism. The problem with that device is, number one, it's uncomfortable, it hurts, it can cause headaches, as you can imagine. And number two, the soft tissue of the skin dampens some of those vibrations, so it works okay, but you can't hear that well with it.
Step 1 in Dr. Cohen's plan. On both sides of Liam's head, implant a bone-anchored hearing aid known as a Baha. The Baha puts sound vibrations directly into the skull, then to the cochlea, allowing for a better and clearer sound. In January, Liam could hear in surround sound for the first time.
So what does it sound like to hear him both sides, all around the way we hear? Is it great? It was an amazing thing just to see the smile on his face.
You're going to hear the trucks going by, and you're going to think, wow.
He was like, hey, I can hear that. What's that noise? I could hear them talking down there. You know, because he didn't experience full sound like that before.
Life around the Gannon household is completely different now.
Liam, since he's been able to hear, has instantly begun to behave better.
Okay.
Liam, and now that he can hear, he can pick up on sarcasm, which is hilarious.
Liam says he feels like a different boy. Except for one thing. Liam's always wanted what other children have, a pair of ears.
I'm glad you're happy. Thank you.
Liam's grandmother says since the day he was born, Liam has actually been very physically strong. In fact, she says as a newborn, he tried to roll over one time and almost fell off a table. She says he has always been very determined, which has served him well. Up next, taking over where nature fell short.
Creating something and making his life better.
Making ears for Liam when Chronicle continues. Liam Gannon is like any 10-year-old. He wants to blend in with his peers as much as possible. Since birth, though, he has stood out as different, and he's learned how cruel people can be. Now he's taking a big step towards his goal, thanks to some very talented doctors at Mass Eye and Ear. Now that Liam can hear, life around the Gannon house has changed for the better.
He's gotten his balance better. He's not falling all the time like he used to. And he's more patient. He's more like a child that has no difficulties. He's more relaxed, I think, in his own skin.
Tomorrow is the big day. Liam will get his prosthetic ears, and they will change his life, says brother Tyler.
He's always kind of like in public spaces had people staring at him and really laughing at him and even going so far as to make fun of him very openly. I think that it'll be really good for him to only visibly have some facial features that are a little bit more messed up, and then the trach, but he'll have ears, because that actually does make him look a lot more normal.
As Liam and his family sit patiently in a waiting room of Mass Eye and Ear, prosthetic specialist Dr. Matt Jackson prepares Liam's new ears. Made out of silicone, the ears will snap on to a bar clip surgically attached to Liam's skin.
Right now it's pretty shiny because it's sort of like a paint going on. We're going to dry it, and then we'll seal it and then put a dull coat on to be more like natural skin. We're putting in some blood vessels, some colorations. We could add some, maybe a little purple over here.
Prosthetic ears can be traced back to the Mayans. With today's technologies, they are easy to attach and close to natural appearance, says Dr. Jackson. At times, he looks as much an artist as he does a doctor.
I've never taken an art course, but when I was in training, go through various rotations. One of them was the facial prosthesis. They said, well, you have to sculpt the ear or the nose or the orbit. And I go, okay, you know, and I just did it. Fortunately, my father was pretty artistic, and I guess my brother and I inherited a little of it.
Liam's ears are, of course, cosmetic, but he also needs them to wear eyeglasses to help with his vision. Despite this medical necessity, insurance wouldn't cover the expense. So Dr. Michael Cohen looked for funding from the Curing Kids Fund. John Fernandez is the Chief Executive Officer at Mass Eye and Ear.
Back in 2010, we got a new board chair who happens to also be the CEO of the Boston Celtics. And he said, you know, let's have a fundraiser and have it be about cures for kids. and we've raised about over $1 million each of those years, and then we take some of those monies to help kids like Liam.
After a lengthy procedure, Liam's ears are attached, and a tired but happy Liam takes a look.
That looks cool, Liam. Yeah?
With his prescription not yet ready, Liam dons a pair of sunglasses for the first time. The smile on his face is worth a million words, says Dr. Jackson.
This is the most rewarding part of the whole thing, is seeing, creating something and making his life better. Most of my work is with cancer patients, so I'm restoring speech and swallowing all the time. But to get a kid like this and become his friend, too.
Back at school, Liam's friends and teachers are excited to see his new look. His teacher, Anthony Bishop, says his classmates have been supportive throughout this process.
I think he's just thrilled to be able to use glasses and have some place to put them. I'm trying to get him to take off the sunglasses. It's his first day back, so I'm being a little lenient today, but tomorrow I'm going to say no sunglasses in class. I'm sorry.
Hey, Liam! Good, how are you? Nice to see you.
Liam's speech teacher, Sherry Tyson, says the changes have been transformative for Liam.
I've definitely noticed his self-esteem, because his self-esteem has improved so much. His attitude, everything. He just seems happier. He jokes. He's got a great sense of humor that I've seen a lot more of since the new Baja. Meatballs. You like those?
Tyson is preparing Liam for the next step, which will help Liam speak.
Meathead.
He will have surgery to fix his cleft palate. The final step, says Dr. Cohen, will be surgery allowing Liam to breathe on his own.
My dream for him is that we can get rid of the tracheostomy tube, have him hearing well, have him seeing well. A child who has been through so much adversity and yet is so happy and outgoing and just such a joy to be with. I can just only imagine the success he can have if we can do those things for him.
And his grandmother's wish for Liam?
I want him to have all the things that everybody else has, but I really want him to have that compassion that other people have shown for him, because I think him being a nice person after all of this that can see other people for who they are without prejudice is my goal for him.
And next week, Liam will be back at Mass Eye and Ear to get his prescription eyeglasses for the first time. And the next step after that, Dr. Jackson will make that prosthetic palate that will help Liam with his speech and with swallowing. At Mass Eye and Ear, they are not afraid to take on big challenges. How to create a smile when Chronicle returns. The Massachusetts Eye and Ear Infirmary began in 1824 as a one-room clinic to treat Boston's needy. Today, it is internationally known for its treatment programs, research, and education, and its focus on cures for blindness, deafness, and diseases of the head and neck.
Is that hurt there?
There are only a handful of hospitals in the world capable of addressing all of Liam's needs, says Dr. Michael Cohen.
We have the audiologists who can manage this. We have the prosthetist, Dr. Jackson, who can actually create the ears, and just the entire team that can manage sort of the full spectrum of disease for a patient like Liam.
Founded in the early 19th century, the Massachusetts Eye and Ear Infirmary is known as one of the best hospitals in the world for treatment of conditions of the eye, ear, nose, throat, or as they say here, everything from the neck up. It is also known for its cutting-edge research. John Fernandez is Mass Eye and Ear's CEO.
We're actually better known around the world as the great Harvard teaching hospital for eyes and ears. So in Boston, we fight for space with the bigger hospitals, but I think everybody knows if I have a problem with my eyes or my ears or my sinuses or my throat, where do I go? Or if I have head and neck cancer, this is the place to go. We're also trying to find cures. We have a huge research program, the biggest ear research program, the biggest eye research program in the world.
Dr. Eric Pierce is a clinician and scientist researching a cure for diseases that lead to blindness. In his clinical work, he sees patients who have inherited retinal degenerations, vision loss caused by damage to the retina.
We believe that those diseases are caused by misspellings in genes that are required for vision. We try to identify the misspellings that cause the disease or the diseases in the patients that we see, because we're optimistic that we can use that information to develop treatments that will prevent vision loss.
Pierce's lab is looking to develop a gene therapy drug to correct those misspellings and restore vision. He predicts a cure may be found within the next decade.
There are about 200 different genes that, when misspelled, cause these retinal forms of inherited blindness. There is one of those genes called RPE65 for which there has been success in clinical trials of gene therapy, and that's still in early clinical trials.
Are any of those with the Series A?
In another lab, Dr. Albert Edge is working on a cure for hearing loss.
There are cells inside the ear, in a part of the ear called the inner ear, called hair cells, which really detect the sound, and those cells are lost in most cases of hearing loss and deafness, and so we're trying to figure out ways to actually restore those cells. The existing technologies with cochlear implants and hearing aids don't really do that. They just amplify the sound essentially, but to be able to really cure deafness, cure hearing loss by replacing those cells that are lost is really our goal.
Dr. Edge's lab has made some groundbreaking discoveries using two different approaches. One, using stem cell transplants in mice.
The other way is to actually try to develop a drug. We've actually just published a paper recently showing that an existing drug used in deaf mice can actually regenerate some of the hair cells. That, to us, is the preferable procedure because drugs are preferable to actually surgically having to put in new cells, and that right now is looking very promising.
It is the combination of patient care and research that distinguishes Mass Eye and Ear, says Fernandez.
You go to a doctor that today is down seeing patients on the first floor. The next hour they're up doing their research trying to find the cure to the problem they saw in that clinic. That's what makes us different. The research, finding those cures, is what makes us different than just taking care of people.
Dr. Tessa Hadlock is the director of Mass Eye and Ear's Facial Nerve Center. Hadlock's specialty is helping people who suffer from facial paralysis.
It's a really neat sort of niche within reconstructive facial surgery, because all of us who do work around the face are trying to do something to either mitigate deformity or enhance facial beauty or take away something that's glaring. We are trying to get people to be more comfortable communicating non-verbally. Now give me a nice big smile.
Through surgery, Hadlock can literally put a smile on a patient's face.
First stage, we make just a little nick in the leg, and we take out a very long nerve through that little nick by using an endoscope. And then we transplant that nerve from the non-paralyzed side of the face across through the upper lip to the paralyzed side. And then we wait 6-9 months until axons, nerve fibers, have actually arrived at the paralyzed side. Then in a second stage, we steal a tiny piece of a leg muscle from the inner thigh, and we transplant that right into the smile vector on the paralyzed side.
She's the best doctor in the world.
This is the most fulfilling of all her work, says Hadlock.
The smile is really the holy grail of that communication. The idea of restoring that movement and giving that person sort of an opportunity to speak with their face is, what could be better?
Sometimes they see Lyme disease patients there at Mass Eye and Ear because facial paralysis can be one of the effects of Lyme disease. As we mentioned, Mass Eye and Ear started out in 1824 as a one-room clinic for the needy. Today, they have 13 locations throughout Massachusetts, including a brand new facility in the Longwood medical area. And our thanks to the Mass Eye and Ear Infirmary and to the Gannon family for allowing us to tell their story tonight. And that is Chronicle for tonight. Thanks very much for joining us. I'm Anthony Everett. Have a good evening, a good weekend, and we'll see you again on Monday night. We leave you tonight with scenes from the Mad River Valley in winter.